Preview.
But let's talk about the doctor that was recently arraigned in Benue State. That is Dr. Kenneth Kelvin, that was arraigned by the police, for revealing the information of his patient online. Yes, he's my colleague, and I think he hasn't done well. He hasn't done well. I think I will, the essence of this, if I can reach out to the family, I will rather ask them to beg the complainant, let them beg the complainant, because there's no, a good lawyer will tell you the cases you are going to win and the one you are not going to win. Because I looked at the facts of the case, as reported in the media, and there's no need defending him. And I know Medical and Dental Council cannot also call me for making this video claiming that it's against Rule 40 of the Code of Medical Ethics, which prevents a colleague from instigating a case against a fellow colleague. The essence of this is like a warning to not only doctors but other health workers, in the health sector. And patient information is very important. It's very important. It should be handled with the highest level of, confidence. With the highest level of confidence. Remember, in those days, there were 3 professions that people respected. You talk about the priests, you talk about the scribe, that's the lawyers, and you talk about the physicians, that's the doctors. Among these 3, you still see that one of them, has the highest respect, and that is the doctors. You can lie to your priest. Maybe you sleep with a priest's wife. You don't go and confess to the priest that is the wife. Just tell the priest that you had a sexual encounter with a woman. You can also lie to a lawyer, where the thing may directly affect the lawyer. You can lie, but you can't lie to a physician. You tell a physician everything. Because when you come and tell a physician you're having a headache, he will start what we call history taking to establish the possible cause of that headache. And when the cause is known, then of course the treatments will be simple. So I think the doctor went so far, went beyond his powers. And people talk about the medical and dental. I saw that some of my colleagues were commenting that it should have been handled by Medical and Dental Council. Medical and Dental Council was not established to handle criminal matters. Criminal matters are purely handled by the police. It's a simple thing. In fact, if you even take it to civil defense, they will tell you to take it to police. So we have jurisdiction, of powers of these our law enforcement agents. The Medical and Dental Council is established to handle things relating to medical practice. Yes, in this case, we have a part Medical and Dental Council can come in, but the truth is, bulk of the case, lies with the police. So it's a warning to many health workers. I know there was one during the 2011 election. That should be in Enugu, I think National Psychiatric Hospital, if I can still remember, a nurse that came on Facebook and said that he just gave somebody injection, somebody opposing Jonathan. He gave the person, I don't know, but he was opposing a particular party, went and gave the person a sedative to keep on sleeping. And the thing went viral. And at the end of the day, I think the nurse was suspended or something. It may be true that he gave the injection. It may also not be true. You understand? But we need to be very careful. Yes, we have freedom of speech as contained in section 39 of the Nigerian Constitution. However, we should also know that there are codes of codes, or what we call ethics, that should govern your respective professions in the health sector. Now let's go to the facts, or let's go to the relevant laws here. That patient that that Dr. Kenneth went online to reveal his information, section 37 of the Nigerian Constitution, talks about rights to family and private life, that man, or that patient, has that right, and nobody shall deny him of that very right. You understand? That is one. Then coming to codes of medical ethics in Nigeria, now Rule 25 talks about confidentiality of the patient's information. On no account should you reveal the information of your patient. You understand? There's no reason whatsoever for you to reveal it. And the oath we took says that nothing, comes between me and my patient. So what it means is that nothing, even when you go to court and they demand that you reveal the information of you keep on protesting. You keep on protesting. Let the court give an order to say you must reveal that information. Because the oath is clear. In medical jurisprudence, you are not allowed to reveal the information of your patient even after the death of the patient. Let me give one example. We at times we have discordant, couples. Discordant means, let's talk about HIV now. One may have HIV and the other one does not have HIV. You understand? It's very difficult to handle because now this person, you ask this person, do I tell your wife? Let's assume it's the man that is HIV positive. You ask the man, do I tell your wife? The man will say no. You dare not tell the wife. If you do, he can sue you. He can even collect your license. It's a very simple thing. So in that situation, let me tell you my own personal experience. In those years when I was still young in the profession, in those years, I was in one rural community. There was this guy that was diagnosed of HIV positive. We cancelled him before the test. At the end of the day, after cancelling, then after the test, we still did another counseling. Now, at the end of the day, some people can be a little bit wicked. What the young man was doing is, first, anytime I come possibly to the village school or elsewhere, I'm seeing him carrying a lot of girls. Now let us assume that this young man was sleeping with all these girls. And most times when he saw me in a particular place, this young man would have the effrontery to confront me and remind me that you guys still remember my oath. You understand? So that I don't go and because he knew that what he was doing was not good. And who knows, he might be sleeping with those girls without protection, without also telling them about his status. Now, the law did not permit me to approach any of the girls. You understand? One day I was asking myself, I said, listen, what if I saw this guy with any of my church members or relatives or somebody closer to me? What would be my action? The truth is, the law available in Nigeria does not and also did not then permit me to reveal such information. So the only thing I did, because in law, where your own right stops is where my own starts, what I did was to organize health talks for people in the markets, in the hospitals, in so many places. I went to different schools. I was telling them, I'm not against you having sex, but no matter who the person is, make sure the person uses condom. Started telling them about the importance of no matter how healthy that person looks like. You understand? So you see, I have respected, or rather I respected that patient's rights. I didn't call his name. So you must know that Rule 25 of the Code of Medical Ethics in Nigeria, does not allow you to reveal the information of any patient. And that's why even people working in medical records, they have their own training too, how to handle the folders of the patient. So that let's assume if a patient is HIV positive and is married to a woman, and the relative of the woman may be working in the hospital, so the relative must also have look at the folder. So in that situation, people working in medical records should be very careful. Now, this doctor has violated Rule 25 of the Code of Medical Ethics. Yes, we have also another rule that seems to be in conflict with Rule 25 of the Codes of Medical Ethics. That is Rule 44. That allows you to reveal the medical information of the patient, but that is only when that patient has what we call notifiable disease, like the one we saw in Lagos then when Patrick Sawyer came to Nigeria with Ebola. When he came in, Dr. Stella saw it and saw that guy was a threat, a threat to public health. So she had to, do what she did, in order to protect the general public. So you can reveal such information when there is a conflict between the patient's privacy and the issue of public health. So in that situation, the doctor that went online to post something, you can't defend yourself with Rule 44. Even that notifiable disease, you don't notify the public, you notify the Ministry of Health, that you have a suspected case of Lassa fever, suspected case of Ebola, COVID, and all those infectious diseases. That is only one. So now he has gone to Facebook. How much did he make from the Facebook? So most times we need to be careful. We need to know that the patients have rights, no matter how indigent they look like, no matter how helpless they look like. They have rights. The way you have your own rights is also the way they have their own rights. So now the doctor has gone to violate Section 24 of the Cyber Crimes Prevention, Prohibition and Prevention Act, 2015. Now, which is that is Section 24, subsection 1. Now that he has if you go to Criminal Code, Section 375, it talks about when you publish any defamatory, matter, when you publish it, it's misdemeanor. It's misdemeanor. For those of us that know about misdemeanor, is a situation, is an offense that the jail term is more than 6 months, but less than 3 years. It's misdemeanor, and you may face a jail term of about 1 year. So we must be careful when we go to social media. Keep your profession. Even your wife, even your spouse, you're not supposed to tell that person what transpired in the hospital. There's no need. Even if you want to use like Rule 44 of the Code of Medical Ethics, that you can also reveal the information of the patient. That is when you have interest of the public at heart. At times you can reveal the information of a patient, but try to anonymize. Try to remove entirely the particulars of the patient. So I think what I will ask is the PDP official that took him to court, please have mercy on him. He might have acted ignorantly, which I'm aware that Section 22 of the Criminal Code says that ignorance of the law is no excuse, but you can still, we say, to err is human and to forgive is divine. So you can also temper justice with mercy, convicting him of such crime. I think you still do not stand a particular, in fact you don't get anything. Yes, he has maligned your name, he has defamed your name, and so on and so forth. Even if there's sodomy, I think it's not his right. Yes, I know sodomy is a crime in Nigeria, but what if it turns out not to be sodomy? That's another question, because there are a lot of things that happen in the anal canal. People that have rectal prolapse and so on and so forth. It's not necessarily sodomy. Yes, sodomy is one of the causes, but that is not the only thing that can cause rectal prolapse and so on and so forth. I know he has erred. I'm not trying to convict him, or to indict him, but I will still plead with the complainant. He has learned his lesson, and also is also a lesson to other people. That is where I have to come in. Thank you.
Preview.
Please remember to comment, like, subscribe, and share. Thank you.